Male circumcision is basically surgical removal of the foreskin. Now, this is different than female circumcision because we're just removing the foreskin. In female circumcision, we're removing the glands of the clitoris. In male circumcision, we're not removing the head of the penis, just the foreskin. It depends on a person's religion, culture, hygiene. Those are just three main reasons that parents may choose to have their male circumcised. In our culture, it's done for hygiene because we realize it's easier to keep a circumcised penis clean. Plus, when they become adults, they might have problems, and we're going to talk about those. The biggest concern would be smegma, the bacteria that accumulates in body crevices, mainly around the corona, on a penis that is not circumcised. In our culture, they will circumcise an infant most likely when he is 2 days old, just before he goes home from the hospital. If it wasn't for the short hospital stay, probably our culture would choose on the 8th day, as the Jews chose to have their baby boys circumcised. But because they go home, it's a fairly quick procedure, and they will not have to bring them back to the doctor to have it done. They will do it before they go home from the hospital. If they don't, then as an adult, they may decide to have it done, and this can be fairly traumatic because of the pain, the healing process. So most parents today will choose to have their infant circumcised. This just shows the difference between a circumcised penis, letter A, and an uncircumcised penis, letter B. This is a slide that shows the procedure that would be done on a penis as it's being circumcised. The doctor might put a cap over the glands just to protect it, and then cut up and around and then put the stitches. It is a fairly simple procedure. Yes, the baby does feel the pain, but it's very quick, and they do not remember the pain. We usually don't remember things before we're age 3. So 2 days old, this baby is not going to remember the pain. The doctor will then put some salve around the stitches, some gauze, and will teach the parents how to care for this until it is healed. Sometimes they will even put a flat rubber band that's about a 1/4 inch wide around where the circle, the top of the picture, the third one over, that dotted line. They would just put that band there, and then the tissue would gradually die. And then within a couple weeks, the foreskin would just dry up and fall off. Another procedure that could be done would be to use laser. However, there have been some instances where the laser has slipped and cut off the head of the penis. So, to my knowledge, this is not done very routinely, and if you were going to make this choice, I would want to highly research it before you chose to have the foreskin removed with a laser. Here's some information that shows some of the history with circumcision. In 1960, about 95% of all boys in the United States were circumcised. Then, in 1971, the Academy of Pediatrics took a position and said there's really no valid reason. They said, don't not do it, but don't just do it to do it. Really think about it. Make an informed decision. Well, look what happened. In 1986, then only about 59% of the boys were circumcised. But about 3 years later, there was evidence that there was an increase in the urinary tract infections. But they still said not to do it just because of a routine procedure. In 2000, about 65% were circumcised. So you can see that gradually we're getting back up there. 2014, I'm sure the percent is higher. Because there was a time that fewer boys were circumcised, over the years what they've learned, that circumcised men are less likely to have or cause cervical cancer in their mates, so just less bacteria, which will cause less cancer. Also, circumcised men are less risk of AIDS simply because there's less tissue, less opportunity for tearing and bleeding, less penile cancer, fewer urinary tract infections just because of the less bacteria that gathers around the urethra. A couple arguments. There is no evidence that if you're circumcised or non-circumcised that you will have problems controlling your ejaculation or that there will be a difference in sensation. This slide shows the information about some foreskin problems that might arise. Phimosis is just that the foreskin is so tight that when the man goes to have an erection, it hurts. It's hard to retract that foreskin past the corona and can cause a painful erection. Balanitis is they have a problem having an erection because the glands in the corona have become infected and swollen. Chances are because of the smegma, improper cleansing. And then paraphimosis is the name that's put to what is caused by the balanitis. So because of the infection and swelling, it makes it really hard to retract the foreskin. Either in class or in a threaded discussion, we will be listing the pros and cons of circumcision. So be thinking about the positive reasons if you choose to have a baby boy that you would have him circumcised, or the reasons you may choose not to have him circumcised.